So my patient had hepatic encephalopathy. So she came to the hospital after a fall and was presenting symptoms of acute confusion, and then she had a resting tremor, which is one of the big indicators of hepatic encephalopathy. So I had done some research, and it's actually like there's not really like a lab test that tells you like, oh yeah, they're positive for hepatic encephalopathy. Mainly you have to just do neurological functioning test, and then you can look at lab values based off of liver disease. So like your comprehensive metabolic panels looking at like albumin, ALS, and AST. And then you can also look at their ammonia levels because they may have high amounts of toxins and ammonia buildup in their body. So basically it gets in the bloodstream up to the brain and alters their mental status. So whenever I had seen her, she was alert and oriented ×4. And throughout the day, mainly I cared for her. She was having episodes of like frequent diarrhea. So getting her to and from the commode into bed, unhooking the external catheter, which was a good experience for me, and even the wound care people came in and were able to do a change of the external catheter, so that was something that was really neat to see. I definitely got experience with the transportation too. She was a 2-person assist, and she was able to assist with a walker, but this was something that I brought into like safety measures and roles of the caregiver. So with the caregiver, it's her husband, and he was talking to us about how hard it is for him and how physically like drained he is because he can't really get her from bed to the bathroom on time, or he's basically carrying her because she doesn't have the strength to help him. So I really wanted to focus on caregivers on this whenever I was looking at my reflective measure. I actually found an article on overt hepatic encephalopathy management and prevention of reoccurrence, and they actually talk about how hepatic encephalopathy is the recognition of its likely detrimental impact on the quality of life in patients and their relative caregivers. Both minimal and overt hepatic encephalopathy are associated with reduced health-related quality of scores, poor sleep, increased rates of depression, and general loss of independence, including underemployment and sometimes the inability to drive. So this was something that he was talking to me about, was how, like, due to the tremors, she's on, like, anticonvulsants, so she can't drive. She doesn't have the strength to drive. She can't transport herself. And then the altered mental status episodes, all of these just come up to take a drain on him, and I think that it's very important to consider the fact that our caregivers are very important for us to involve in the plan of care. In the Spirituality and Nursing book by Mary Elizabeth O'Brien, she writes that because healthy families generally function as units, it is important to minister the spiritual needs of the entire family when one member is ill or in need of support. Families faced with serious short-term or chronic term illnesses of one of the members can benefit greatly from spiritual support provided by friends, church members, or pastoral care, both from within or outside the healthcare system. So this was actually the first time that I had been in contact with a family member, and I think that it is really important, especially with patients that have like the altered mental status or that are super weak, that you're actually worrying and caring for the caregiver as well. Safety is a big concern for her, and definitely, like, upon discharge, if she's going to a rehab facility to gain strength, that's great. If not, Discharging needs to involve making sure that the house is equipped with equipment, and that he, like I had said even in my care plan, make sure that even if she could just stand on her own for 1 minute, that would help tremendously with him able to get like a commode to her, or just figuring out techniques of pushing off and transportation. So that was something that I pulled out on the side of caregiving, because I hadn't really dealt with caregivers that much. So I didn't really have to do a lot with her condition, but definitely what her condition has put her, the state that it has put her body in, is definitely something to think about, not only for her, but for her caregiver as well. I also, for my reflection, wanted to focus on safety for her. So for safety, I definitely want to talk about the medication being passed. So my medication was passed by my nurse, and she did not stay with the patient as she took the medication. So she left the patient. I watched her take half the medications, and then she got to this one pill and she was like, oh, I don't take this anymore. So I called the nurse, told her that she is having trouble taking this medication and that she doesn't think that it's the right medication to take. So she comes back, tells her that the medication is fine, and then leaves. And I watched the patient as she's taking the medication, and with the tremors and shaking, she's not able to get the medications to her mouth. They're falling everywhere. And this is a major concern for her being in long-term care, whether it's like rehab or just care at home. It's very important that somebody is with her, and for her safety, that she's getting these medications in her. Even like one medication was found by the husband, and he popped it into her mouth, and that was like 5 hours past due. And definitely, like, if they're at home and pills are falling and they're seeing pills and popping them in, they could be from different days. So I definitely pulled out. I saw the medication administration error of not watching your patient take them, and then just watch the safety concern for when she goes home. So those were the two main things: care of the caregiver and then the safety. But I definitely learned a lot from this patient. I never knew that like liver and kidney function can affect like your mental status like they do in this case. So that was definitely a good learning experience for me, and good transportation experience, seeing the catheter, and then as well as just being able to do like peri-care and helping with like the commode and analyzing stool and being able to see what you watch out for. So it was overall a very beneficial day.